Hi, welcome to an Aging Life Care Moment. I am here with Jeff Pines, one of our longtime Aging Life Care Association members. Jeff, welcome, and thank you so much for taking the time to talk to us.
Hi, Ann. Thanks.
Could you tell us a little bit about yourself and your background and how long you've been an Aging Life Care Association member?
I joined the organization in 1999 and I think went to my first conference in 2000. I live in Santa Fe and I was the only guy sort of doing care management here. So I was so delighted to find a group of people that did exactly what I was doing in the world. And I realized I'm 14 years late at it because the organization started so much earlier. And it sure gives me respect for those pioneers that started this, that they were able to connect both coasts of, they'd started in New York and I think in California, and they got people together. And the fact that this is 35 years going on is just fantastic to me.
So Jeff, in terms of your practice, what was your background from an education perspective?
I have a master's in public health and community development and had been doing a lot of public health in my life, but I started in the early 90s doing case management with HIV/AIDS clients, actually, and started my organization doing care management in 1998. And even though I'm not a social worker, I felt like I was sort of doing medical social work as I was going forward. And
all those social workers were rubbing their magic stardust off you, right?
Yeah.
That's how I felt as a nurse as well. I feel I've got a little social work going on, and I sometimes, there's that lovely collaboration. What roles have you played in the organization over the years, Jeff?
I got into the organizational part of the organization through conferences. I co-chaired a conference for the Western chapter in Santa Fe in 2007. And then I co-chaired the national conference in Albuquerque in 2010. And through the Western chapter, I ended up on the board and served on the board of the Western chapter, became the president. And then I got into the national board through the conference chairing and worked on the public policy committee. And then I was the treasurer for a little bit and ultimately became the president in 2015, right as we were becoming the Aging Life Care Association. It was the most exciting time for the organization.
So you were there for the whole rebranding from the National Association of Professional Geriatric Care Managers to the Aging Life Care Association.
It was a real ride, and I was so impressed by the way it happened and the consultant that we used, who was such a pro, and so nervous about how it was going to roll out and how people were going to accept it. And it's been a great boon for the organization, in my opinion.
It took great leadership as well on your part. And I would say that that branding has been ultimately so successful.
Yeah.
So successful. So over the years, what have you seen change about the organization as it's grown? Can you tell us a little bit of your perspective on that?
Well, I think when I first joined, I realized this was an organization of supporting ourselves and increasing the standards with which we practice, trying to connect us. And I think over the years, that has still been a focus of the organization, but now I feel like it's much more of a professional organizational way of looking at this field and us in a much larger field of aging care. And I just am so impressed. I'm actually on the standards committee now, and I'm so impressed by the work that's being done on standards that were created years ago, but being updated constantly, thinking about, is this still the right way to do things? Is this still the right way to train people in this field? So, and of course, the organization has grown tremendously. I love the diversity that I see when I go to conferences. I love that young people, I feel kind of old these days, but I love the young people that I see at the conferences and think this is really a wonderful span of an organization. It's about growth and life. And
What would you say to a young person that might be in a health-related field that's thinking about, maybe starting their own business or even joining another care management organization and potentially joining ALCA? What would you say to them as in terms of a value added that the organization would bring?
well, value added, I'd say you just will get so much more out of the work if you understand the way this organization has sort of paved the way for you. I would say, I mean, this is a field that you can call the shots. You can be your own person. You can really help people in tangible ways that you don't often see in the healthcare field unless you're on the ICU maybe. And I would let them know that you will find a camaraderie of people that are in the very same boat that you are. And often in national conferences that I've gone to, like the American Public Health Association, there's just so many ways that people practice public health. It's so much bigger than just me. But in this case, in the Aging Life Care Association, I feel like everybody's doing the same thing. We do it somewhat differently, and that's, again, one of the glories of the organization. It's its ability to offer the sort of standards and support for people doing the same thing, but in different ways. I just think that's really fantastic.
As you said, Jeff, you're among your people when you're with the Aging Life Care Association.
Yeah.
I want to thank you for your time today, Jeff, and thank you for the contribution that you've given, the service over the years to the organization to make it what it is today. So thank you so much.
Thanks, Ann. Nice to talk to you.